So thank you, Caroline and Kate, for such an excellent start to this discussion. And I would just say that having met Kate and Caroline and Anna, who presented yesterday, you know that you had a profound impact on my year as president, and certainly kept holding the mirror up to me and giving me that real positive challenge and help in terms of thinking differently, because I know that my council was one of those that would send pen pictures as you described, and I have to say it just simply isn't good enough. So thank you very much for that excellent start, and it's great to see you both again. If we move on now to a favourite, a colleague in the past and a colleague now in a different role. So we've got Kate Terroni, we're really pleased to see you here this morning, Kate, who's the Chief Inspector for Adult Social Care at the Care Quality Commission, who's going to talk to us about what CQC have learned from the pandemic that we've all been going through. And it'd be really interesting to hear your views on how we might move forward as well. So over to you, Kate.
Thank you. Thank you, Julie. Really pleased to be here today. When I think back to the conference last year, the first 2 days of the conference were my final 2 days as director, and the third day of the conference was my first day as chief inspector. So it's got me reflecting on what a massively eventful year it's been for us in the sector. So really delighted to join you today. I'm going to talk a bit about what we have learned in terms of what's happened in the sector, particularly during COVID. I'm going to reflect a bit on how we have adapted the way we've been working as a regulator and what we found out through our conversations with providers. And then I'm going to turn to what we do next and the future. So I think it's fair to say, I'd echo Caroline's comments that actually COVID has magnified all of the issues that the rest of us in the social care business could have told you were there to begin with. So it's raised issues around workforce, around funding, around innovation and integration, about the market and about data. So if I just work through those. So if we think about workforce first. So before COVID, Skills for Care shared with us data that said there were 122,000 vacancies in the social care sector. And depending on the role, turnover rates could be as high as 37%. So we know that being a social care worker is a fantastic job. It's a great opportunity to support people to live the lives they want to live, and it makes a real difference to people's experience. But we also know that being a care worker often doesn't have the reward or recognition or career pathways that we would want for it to be a career of choice. So it's been great, the amount of focus that has been placed on what social care contributes to society, to supporting people to live the lives they want to live through COVID. And what we're really keen to see is that recognition translates into reward, to terms and conditions, to career pathways. That means that 16, 17, 18-year-olds leaving school make a choice to come into social care as a profession and then have the ability to stay in it for the next 20, 30 years. So some big lessons around workforce. Now, money, so I don't need to tell this audience about the challenges about the absence of having a long-term sustainable funding solution for social care. We at CQC have been talking about it throughout the years, but certainly since 2016 in our State of Care annual reports. So I think it's worth acknowledging the additional investment that has been placed into social care. But I think the challenge is that the money is welcomed, but it's often short term and it often has a set of deliverables against it. That means that you as commissioners, providers struggle to do that longer term planning because of the short term nature of that investment. So we, along with ADASS and many other people in the sector, are really keen to see that long term sustainable funding solution, and for people to understand that investment in the NHS without equivalent investment in social care will only ever get so far. We've really seen innovation happen. So there was lots of innovation happening in the sector anyway. TLAP and Sky, as already mentioned, has their innovation network. So we've seen really good examples of innovation. I think what we sometimes struggle to do in adult social care is when there is good innovation happening, to be able to spread that learning as rapidly as we need to, so that all parts of the sector are able to raise their game. So some interesting reflection about good innovation, but how do we ensure that is happening consistently across the country? And again, integration. So we know from previous work we've done that there is some really good joined up care happening around the country to support people to get the outcomes that they need. But that is not consistent, and that's not consistently everyone's experience. With regard to markets, so we have a vibrant market in adult social care. The great side of that is it gives people choice. So it gives people choice about which services they should be able to choose to access. The flip side of it is it makes it quite challenging. So there are some challenges around the fragmentation, but also the fragility of some parts of the sector. And finally, I just want to mention data. So there are some real challenges around data. And I think sometimes it's harder to make the case for social care because of some of those gaps around data. So at the start of the pandemic, CQC, along with ADASS and LGA and the department, NHSE, various other partners, talked about wanting to reduce the data burden on providers during the crisis. And we talked about wanting to make sure that when we got the data in, we squeezed every bit of use out of it to ensure that we were shining a spotlight on issues and getting action as and when needed. I think it is of note. So the National Audit Office released a report a couple of weeks ago that said that actually there is not a single home to tell you the number of people who are accessing social care in any one day. So I think we have a real challenge around how we capture data in a way that tells our story well, that is able to talk about the number of people waiting for assessment, that is able to talk about the number of people once assessed waiting for services to meet their needs, that is able to give the evidence that we need to put across the case that we know about what needs to happen in the social care sector. So some real challenges we had before about data that was magnified, particularly during COVID. So those are just some overarching reflections. If we could move to the next slide, please. Okay, so we, along with every other organisation represented on this call and in this meeting, had to think very rapidly about how we adjusted the way we work to respond to the pandemic. So we had the challenge of how do we ensure people are still getting high quality, person-centred care in the absence of being able to regularly go out and cross the threshold. So we made the decision early on that the potential risk that my inspectors might have posed in regularly crossing the threshold of into people's homes and into care homes, etc., that might have had on potentially spreading COVID. So we stopped routine inspections at the beginning of the pandemic, and we thought long and hard about how we were able to continue to have good visibility about what was going on out there for people. So we rapidly developed something called our emergency support framework, which is basically a structured way that we had monitoring conversations with providers through quite a narrow lens to look at their preparedness for COVID, issues around safety, issues around good infection prevention control. And through the life of the pandemic to date, we've spoken with over 20,400 providers. So we've had lots and lots of contact with social care providers. And it's fair to say in the majority of cases, social care providers working in partnership with commissioners, with families, with other stakeholders have done an absolutely remarkable job. And they've done a remarkable job because we started off in this pandemic with those key issues I mentioned up front, with challenges around workforce, challenges around funding, etc. Where we increased our interactions with providers was where we had concerns about the quality of care. So this is a much smaller number. people. But because we weren't crossing the threshold as regularly, we spent more time thinking about how we could work better with you as local authorities and with clinical commissioning groups and other people to really understand what your knowledge was of a service and to share that intelligence so that we had, as best as possible, a good view of what the risks were and what was working well out there. We also placed an increasing emphasis on hearing directly from people who are receiving care. So we were speaking with providers, we were spending an increased amount of time in conversations with your quality monitoring teams, but also we launched a couple of weeks ago a Because We All Care campaign, which was to encourage, it's in partnership with Healthwatch England, and it's to encourage people who receive care and their families and people who work in services to tell us directly, to give feedback on that care. So we have a better up-to-date view of what's going on out there in those services. So when we did cross the threshold, it's been on 67 occasions since the start of the pandemic. We saw many of the same issues that we would have seen prior to COVID. So where we had concerns, they were often around things such as lack of leadership of a provider, change in registered manager, environments that were closed in their culture, so environments that were not outward looking and that had a kind of a closed culture. We also saw examples of providers failing to respond to people's changing needs, etc. So the things we saw when we went out were very similar to what we would have seen in those services we were more worried about prior to COVID. Where we had concerns, I've seen some excellent collaborative working with local authorities. So we had an example of a home maybe about 3 weeks ago in the central region where over a period of a weekend, my inspectors worked with the local authority and the CCG. And because of the extent of the concerns of the home, we worked together to support those residents to move to alternative homes, and we close the service. So that's an exceptional circumstance, but it demonstrates how effectively we work together as organisations when we need to take action. In relation to the market, so as you know, we have a market oversight function within CQC. So for those hard to replace, either large or specialist providers, we have additional oversight on their finances so that we can be assured around continuity of care. So it's not for the whole sector, it's for a section of it. But through that monitoring that we do anyway, it became apparent through COVID, and you would have seen this, I imagine, locally, that there has been a reduction in occupancy in care homes, in residential and nursing homes, and that occupancy has fallen just below the 80% point. We haven't seen a notable reduction in the total number of beds available for people during COVID, but there is often a lag in that. So we haven't seen it to date, but that's not to say we won't see it in the coming months. And again, ADASS on this call will have a more up-to-date on the ground view of what you're seeing in your patch. And also in terms of the market, it's been interesting to note that home care providers that are under our market oversight scheme have reported a decline in hours delivered. So when we think about 100% of commissioned hours, they've been delivering about 94% of those commissioned hours during COVID. And when we've looked into that, that has often been individuals choosing to not have their care workers come in during COVID, either for fear about having other people coming into their home and the potential risks around that, or because family members have moved in to provide that support. And we know from recent data produced by our carers charities that an additional 4.5 million people have taken on the role of being a carer, providing that support during COVID. So that's what we've seen. And then I'm just going to talk briefly about how how organisations have worked together to provide joined up care. So we know that people's experiences of quality of care are largely impacted by two things. One is their ability to access the right care at the right place in the right time. And then the second thing is how joined up that care is to meet their needs. So this recognition, we all know that, to provide holistic care for a person, they want to tell their story once, they want all the people supporting them to be up to date and to work together in partnership to agree goals. So it's really important important that we, as a regulator, regulate in a way that encourages providers to work collaboratively to provide joined up care for people. So some of you may remember back in 2018, CQC undertook a series of local system reviews where we went out to 20 local authority areas in the country to look at how older people at the point of crisis during a potential hospital admission and their transition back to their own homes. And we produced a report called Beyond Barriers, following those local system reviews. And in that report, we produced a bit of a blueprint about what good local working looks like to ensure people get joined up care. And it's not rocket science, but it talked about things such as a good local vision, pooled budgets, joined up commissioning, good involvement of the voluntary sector, good co-production with people who use services from the starting point. So we produced that blueprint. And then going into COVID, there was variability around the country about how joined up that working was happening. So we don't have currently the powers to continue to do local system reviews. And what was so unique about them was the ability for us to comment on the contribution commissioning behaviour has on people's experiences of how services are designed and delivered. But in the absence of that, we are undertaking something we're calling provider collaborative reviews. So as of about a week ago, we've gone out to 11 systems around the country to talk to health and social care leaders to find out what worked really well during the first 16 weeks of the pandemic and what were the barriers. And the purpose of this is to produce a report in September that says this is what good looks like, this is what systems need to think about having in place in anticipation of a potential wave 2 or the kind of tricky winter that many of us are anticipating. So there's provider collaborative reviews are happening now. In them, there will be conversations with ADASSs and with DPHs to hear your feedback as well on it. And the emphasis is very much about being supportive. We want to hear best practice. We will be sharing our findings with those individual systems. We will be publishing themes, but we won't be publishing individual findings of those systems. But wanted to flag to you that that's the work we're doing, and that sort of approach about the emphasis being on how organisations work together will play an increasing part in how we regulate going forward. And I'll come back to that when I just talk about our strategy. So thinking about what's next for us in terms of how we regulate and what we expect to be focusing on, we are moving into a kind of transition phase in the coming months. So previously, CQC would go out to services. The frequency with which we would return to services were very much based on the previous rating of a service. And actually, in thinking about what the public wants in terms of having the most up-to-date view of risk, of which services are delivering, we need to be far more responsive and agile in how we regulate. And we need to do better at bringing together all the data, all the intelligence that sits with you as local authorities, that sits with CCGs, that sits with people who receive that care, to have a more responsive view of what's going on out there. So I anticipate that the way we regulate will look quite different. Previously, we would do comprehensive inspections and produce quite long reports. The challenge for us is how do we do something that is quicker, more responsive, and maybe in a much shorter document gives you what you need if you're looking for care for someone that you support. So that's what we'll be doing, and we'll be taking all of the learning we've developed through COVID. So things such as again, probably like your experiences, really thinking about where have we got added value through doing things virtually, and where do we need to be in person. So for example, when we think about how we regulate home care agencies, we would often go out to a home care registered office and sit in often a very small office with not many people around, certainly no one who receives care in the office, and we would start our inspection. There's a question for us about actually what can we be doing remotely in terms of home care inspections. That doesn't mean that we need to go and sit in people's offices, but we can spend more time talking to people who receive that care to find out how that's going. We're going to be placing an increasing focus on infection prevention control. So in all of the inspections we do over the summer, there'll be a sharp focus on that. But in addition to going out to the services we are more worried about based on risk, we will also be looking at 300 services with a view to gaining best practice around infection prevention control. And then just turning to the future. So we are developing our new strategy as a regulator from 2021 onwards. And we are developing our thinking around these 4 pillars that we'd love to hear your thoughts on. So we've been thinking about how we regulate through the eyes of people who receive services, and we are having a really active conversation that I am strongly pushing around the role of TLAP's I statements in terms of regulating services through how they meet people's needs in the way that they describe how they want that to happen. So we're looking at that, and in that we're also thinking about what is our role in terms of talking about people's approaches to understanding their population, issues around accessing care in a timely way, etc. We're looking at how we regulate in a much more flexible and agile way, as I've described. We're talking about, we're going to be focusing about safe care. And this bit was always something that kind of grated a little with me in terms of whether it could be paternalistic. And we've been talking about how the focus on this could be about how people are equal partners in being able to describe what safe care looks like for them. And then finally, and I'm noting Caroline's challenge about is improvement the right word? So I go into this having heard that, is what is our role in supporting the sector to improve? So we still have more services that requires improvement, a smaller number that are inadequate. And I know we would all want to see every person who receives health and social care to be receiving an incredibly high standard of that. What's our role as a regulator in that? We have improvement type conversations with providers when we go out. But what might an improvement alliance look like? How do we work as effectively as possible with your quality monitoring teams that I think vary in terms of what they're able to offer around the country? What's our role with TLAP, with Sky, with Skills for Care and with trade associations to ensure that there is a consistent offer of improvement to services that may be struggling? So I did a Teams broadcast call with 1,000 providers about a week ago, and I asked them what their experience was of improvement. For the large providers, they had the kind of corporate offer, and they do all their QI, and they have a relatively strong position. It was the smaller providers who talked about. There was one example of a woman who said she'd recently become a registered manager of requires improvement. Of a care home that requires improvement, and she described feeling completely lost as to where to look to help her raise the standards of the care she was providing for the people that they supported. So a bit of thinking that I'm doing, and I will work with James and with Caroline and other colleagues, Clinton, to think more about what should our role as the regulator be around driving improvement as we go. And then just the final slide for me is just about how you can get involved and share your thoughts. So I'm on Twitter. We've got the CQC Prof account for you to follow. We have bulletins that we give to our providers every week that you might be interested in receiving. And then we have an electronic platform called Citizens Lab, where we share things for people to comment on. So most recently, we've been talking about our registering the right support revisions. So how we register new services for adults with learning disabilities to ensure that they are small, person-centred, etc. We're revising that guidance. It goes live in September. And that's an example of a document we shared on Citizens Lab to have wide engagement about what should and shouldn't be included in that. So just a plea if you're interested to get involved and have those conversations with us. Thanks, Judy.